Good afternoon. The rate of infection continues to accelerate, and to date, Namibia has recorded 1,906 confirmed COVID-19 cases. It took 4 months to record the first 1,000 cases in the country, and 14 days to record 2,000 cases. It took 11 days to record 3,000 cases, and 6 days to reach and record 4,000 cases. At the current rate, it is taking the country an average of 3 days to record 1,000 new cases. In the wake of the COVID-19 pandemic, significant investments have gone into increasing our testing capacity, enabling us to test 1,160 samples on average per day at local laboratories. In the absence of cure, or vaccine, it becomes crucial that we enhance our ability to speedily identify affected citizens, especially those who are asymptomatic and pre-symptomatic, as they have the ability to spread the virus without showing any symptoms. For this reason, we will continue to strengthen our national testing capacity. At present, Namibia has the highest rate of new infections per population on the continent, and there are now confirmed cases in majority of 34 health districts, with the exception of the Andara, Aranos, and Nyangana. This is, of course, attributable to the size of our population, testing coverage, and transparency for public information. In terms of testing coverage, Namibia has tested 21 people per 1,000 persons as at 27 August 2020. This is among the highest testing coverage on the continent, surpassed only by South Africa and Rwanda. As we review and adapt the national measures today, we are targeting efforts to respond strategically to the situation on the ground and in the best manner to protect Namibian lives and livelihoods. Through projections, simulations, and modeling, we are also applying foresight to prepare for the coming few weeks. We are continuously monitoring the geographic spread of COVID-19 infections. The Rongo region accounts for 3,400 cases. That is about 49.2%, the total number of confirmed cases in the country. Notably, 3,230 of these cases are from Walvis Bay. The Thomas region and Windhoek in particular has shown a sharp rise in the rate of the infections. Windhoek now counts for 2,792 cases. That is about 40% of total confirmed cases. Xara's region records the third highest number of cases in the country, with 132 confirmed cases, or 2% of total confirmed cases. Plus that community transformation has been confirmed in Windhoek. In other parts of the country, there are sporadic and clustered community outbreaks, giving rise to increasing numbers of cases nationally. As of today, sadly, 65 of our citizens have lost their lives due to the virus. Over the past 2 days, we recorded our youngest COVID-related death, a 17-year-old female with pre-existing conditions and 25-year-old male with no pre-existing conditions. The tragedy of these deaths, as well as those of the 63 other citizens who have succumbed to this disease, highlights how vulnerable we all can be to the effects of this virus. This is also why we should adhere very seriously to the health and hygiene protocols and regulations. This is also why we should adhere very seriously to the health and hygiene protocols and regulations. 55 of 65 COVID-related deaths occurred during the month of August alone. Many of us have lost relatives and friends to this virus and are mourning the loss of loved ones due to this pandemic. May the souls of those who have referred to rest in eternal peace. I therefore appeal to all Namibians to take this virus seriously and exercise utmost caution in behavior and contact. By failing to adhere to protocols, you could be placing your family members, neighbors, colleagues, and other citizens at risk. Let us all take responsibility for our health and safety and that of others. Each one of us must display leadership by safeguarding our lives and those around us, and not wait for government and police to do that for you. We cannot control your behavior. Discipline and responsibility must begin at home. With evolving scientific knowledge, we are learning more about this novel coronavirus each day. This is knowledge we are using to adapt and hone our national response. We now know that the period of both quarantine and isolation can be shortened. We know asymptomatic individuals can safely quarantine and isolate at home under supervision where there is sufficient space. There are encouraging supportive treatments that can improve survival when people become very sick with COVID-19. One of those drugs is remdesivir, which is considered to be most effective in the world right now, has arrived in Namibia on Monday. We are rising to the challenge of both preventing new infections as best as we can, while also providing the best possible treatment for those who do become infected. In light of the unfolding situation in the country, Climate met this week to assess and determine the next measure in our national response based on key indicators and data. After extensive consultation with stakeholders and experts, it has been resolved that the current dispensation of Stage 3 regulations be extended to all regions, all 14 regions of the country, for an additional 14 days. The extension will come into effect on 29 August 2020 until midnight 12 September 2020, with the following additional measures. For Thomas region, the current dispensation will be maintained and extended. Travel restrictions remain in force, prohibiting exit and entry into the restricted city of Windhoek, Okahanja, and Rehoboth local authority areas. For Erongo region, the exit and entry travel restrictions on Walvis Bay, Swakopmund, and Arandes local authority areas is hereby lifted. Members of the public may now travel into and out of this area to the other parts of the country, with exception of the City of Windhoek local authority areas. The following measures will apply in addition to existing Stage 3 regulations for all 14 regions of the country. 1. Our measures aim to suppress the spread of the virus through the movement of people, while minimizing impacts on livelihoods and business. The daily curfew from 20 hours to 5 a.m. is therefore extended to countrywide curfew. 2. Public gatherings remain limited to a minimum of 10 persons countrywide. 2. Education. On education, vocational education training providers and universities are to continue operating across the country. Face-to-face instruction may be conducted where prescribed health and safety standards have been met. B. Grades 10, 11, and 12 are to continue with face-to-face instruction countrywide, including Windhoek. C. Early childhood development, grades 0 to 9, are to reopen for face-to-face instruction from 7th of September 2020 countrywide until including Windhoek. 4. The Hosea Kutako International Airport will open from September 1st, 2020 for the International Tourism Revival Initiative, as per modalities communicated this week by the Minister of Environment, Tourism and Forestry. 5. Restrictions relating to liquor. A. The trading hours for the sale of alcohol remain the same nationwide, and alcohol is to be sold for off-site consumption only. B. Outside of the restricted areas, restaurants, hotels, and similar businesses may sell meals and alcohol to be consumed on the premises during specified trading hours and subject to curfew hours. C. However, restaurants, hotels, and similar businesses operating within restricted areas will only operate on a takeaway basis, and sale of alcohol is prohibited for these establishments. 6. We know that elderly Namibians are particularly vulnerable to this virus. I therefore direct all old age homes across the country to take the necessary precautionary measures and staff management arrangements in consultation with the Ministry of Health, Social Services. Caregivers should be provided with personal protective equipment. The virus is likely to remain in our midst for a prolonged period of time. We must learn to live with it. This is true. However, learning to live with the virus does not mean going back to life as we knew it. That is not learning to live with the virus. That would be befriending the virus and allowing it to continue devastating life, health, and economy. Truly learning to live with the virus means adapting our attitudes and behaviors so that we can reduce the damage it can do to our country. It means sacrificing some of our comforts and even income-generating activities in order to keep our hospitals operating, schools functioning, and empower our businesses to grow again. I'm aware that over the passage of time, some citizens are increasingly frustrated, anxious, and may be discounting the introduction of new measures altogether. This can affect our personal and shared lives. I am confident that if we work together, acting sensibly, and continue to use good judgment, Namibia can slow the spread and reduce the rate of infection and move the country towards more ease restrictions. This will require our collective and concerted effort. Let us therefore remain united and steadfast as responsible citizens. Let us be our brothers and sisters' keeper and come together in a spirit of patience, kindness, empathy, and understanding. Let us keep the faith and stand in prayer for our nation. Let us hold hands and pull together in the same direction and prove that no challenge is insurmountable for our nation, which is united. It is now up to each and every one of us to make the best decisions in the interest of self, that is yourself, your family, your community, and our nation. I thank you. Is there anybody who is going to supplement?